morning. Uh, okay, now that we got the sound working, I think it's a lovely morning and a great time to start off this session on operational control of mosquitoes. So without further ado, let me introduce our first speaker, Sanji from the Institute Pasteur in Madagascar. And he's going to talk about a subject that's been absolutely at the front line of malaria control for the past couple of decades, mosquito nets and their evaluation.
Thank you. Ladies and gentlemen, good morning. I am Sands. I am a PhD student from Madagascar, and today I am presenting you my work about how to evaluate mosquito nets faster and cheaper. As you may know, in addition to indoor residual spraying, using of long-lasting insecticidal nets is one of the major tools to prevent malaria transmission. I'd like you to look at this graph from the World Malaria Report 2015, which show us the number of delivered nets by manufacturers and distributed nets by the National Malaria Control Program across sub-Saharan Africa from 2004 to 2015. And as we can see directly, this number of nets increased from year to year. For those who works on public health, the main question is that what is the percentage of invalid nets and valid nets distributed across households? But for us entomologists, the question is to know if the WHO method is the only valid method to validate the net's efficacy. In fact, according to the WHO protocol, monitoring of net bioefficacy need a high number of susceptible female mosquito. For instance, to test one net, we need 100 female mosquitoes in addition to which used for the control. And added to that, a high technician skills and a good insectarium conditions are needed. So, as you can see, monitoring the net bioefficacy is a time-consuming method, is highly expensive, and therefore the answer of the study can be delayed. That's why I'm presenting you today two solutions. First, by reducing the number of mosquitoes for testing, and second, by using a colorimetric field test to estimate the concentration of insecticide on the nets. First, reducing the number of mosquitoes for testing, but how? For this, we use a database from CON BioSA of 235 nets. Then we take into account several scenarios against Bayesian model of true validity. And then for each net of the database, we take into account for all possible combination of 4, 3, 2, or 1 con for each side of the net. And we have measured the mortality as outcome, so the mortality of mosquito after 24 hours exposure. Sorry. And then for a sample of 20 to 160 nets, for a sample of 20 to 160 nets, 10,000 random sampling were performed. And for each resampling, the proportion of valid nets estimated by the Bayesian model and the proportion of valid nets observed by the random sampling were calculated. So, in this graph, you have each color of the box plot represent the number of con tested. And as you can see, when we have a sample of 20 nets, the proportion of valid nets, the proportion, the proportion of valid nets with two counts with, excuse me, the proportion, the proportion of valid nets with two count, the difference between the proportion of valid nets estimated by the Bayesian method and the proportion of valid nets observed with the random sampling is very slight, 0.4, 0.4% with a high accuracy, high specificity, and high sensitivity. I'm sorry for the, I don't know what, how does it. Okay, okay, okay. And we have the same result with 4 counts. So when we have calculated the difference between valid nets estimated and observed, the difference is very slight with 0.01% with an accuracy, a specificity, and a sensitivity more than 90%. So what can we remember from this is that halving the number of counts has a negligible impact on the assessment of mosquito nets, mainly when we measure the mortality. And therefore, the time for the process of decision for public health purposes can be decreased. And with this improved method, we can reduce the number of mosquito breeding, reduce the technician times for breeding mosquitoes, and mainly the total of net duration test is reduced. So globally, the overall cost and time for net testing is reduced. And as I told you previously, the second solution is by using a colorimetric field test to estimate the concentration of cyanopyrethrate insecticides on nets. In this picture, you can see the all chemical materials to perform the CFT. And in this part of our study, we performed the CFT on 21 nets made of polyester and coated with deltamethrin. And we have performed also a CFT on 15 other nets made of polyethylene and incorporated with alpha-cypermethrin. And in both cases, we have compared the result from CFT cutoff value and result from the bioassay test con. So as a result, with the 21 nets made of polyester and coated with deltamethrin, when we take into account the CFT value, the CFT cutoff value determined by a CFT cutoff value of 0.35 microgram of insecticide per sample of nets, determined by Green and colleagues in 2013, we can see that when we have done the comparison with WHO contest, our results show that 20 of 21 nets are correct. And for the nets made of polyethylene and incorporated with alpha-cypermethrin, it's the first time that we determined a CFT cutoff value of 0.6 microgram of insecticide per sample of nets. And when we have done the comparison with the WHO contest, 12 out of 15 nets are correct. So what can we remember with this is that CFT is proven to be a useful method for insecticide content estimation because we can use it on deltamethrin and alpha-cypermethrin nets containing a higher insecticide concentration. Added to that, CFT allows for testing a larger number of nets with less variability compared to the contest, which depend mainly on on mosquito production. So we can say that CFT is comparable to WHO contest in detecting nets with low amount of insecticide. So as conclusion, we can say that by halving the number of mosquitoes using during contest and by using CFT with these both improved methods, we can save much time and much money, allowing a faster decision for malaria vector control program. And before ending, I would like to acknowledge the CDC, the Swiss Tropical and Public Health Institute, the Initiative 5% and the Polyvalent Project, and mainly the Malagasy Ministry of Public Health. Thank you for your attention.